Still to come this morning, a potential medical breakthrough. Experts saying the secret to slowing down brain aging could be sitting right in your ear. We're going to explain. That's coming up next. In Health Watch this morning, new research shows how hearing aids could be a key ally in slowing down brain aging among adults with cognitive impairment. MedStar Georgetown Nuclear Medicine Chief Dr. Giuseppe Esposito joins us with more. Good to see you.
Hi, Maureen. Good to see you, and thank you for having me again.
Absolutely, absolutely. So what has nuclear medicine imaging shown researchers about the impact of hearing aids with the brain aging process?
Yeah, so this was a study that was conducted in California, University of California in Los Angeles, by the group of Daniel Silverman, the person Natalie Kilala, the researcher, is the one who conducted the study. And it's very, very interesting. The study was presented at the Society of Nuclear Medicine meeting this past June in Toronto. And you see the images there, right? So that's a PET study, and we call FDG PET. And essentially what it does, it shows the metabolic activity of the brain. So as the brain activates or functions, uses glucose, and that's the image that you see. So what they saw, they took a number of patients from a larger study, which is a study that looks at dementia, Alzheimer's disease, right? And they selected the patients that had hearing loss. What they were able to find is that the patients that had a hearing loss, but they were not using hearing aids, had a reduction in the metabolic activity in the more anterior, the frontal parts of the brain. Instead, the patient that did use hearing aids did not have that reduction in the function of the anterior parts of the brain. And so the nuclear medicine study, the PET study, was able to show that. And although we know from studies in the past there is some relationship between hearing loss and cognitive or mental dysfunction, this study using a PET, again, is very important because it gives us the evidence that really the brain function declines in some areas if the patients with hearing loss do not use hearing aids.
So what does this nuclear medicine study then mean for those who are considering hearing aids?
Well, again, what it does, I've had, my grandfather, my grandmother that, had hearing loss and they didn't want to use hearing aids. I said, no, that's complicated, all that. But what it tells us is that, again, there is, if you don't use hearing aids, again, there is some reduction in the function, some parts of the brain that can happen, and it would not happen if you were using the hearing aids. Essentially, it is very, very important for proper function of the brain, looks like, to use hearing aids. And these patients were followed for 2 years, right? And so over 2 years, the reduction of the brain function was there for the patient who did not use hearing aids, but not if you were using hearing aids.
In our last minute here, what else can we learn from hearing loss and brain functions?
Well, there are a lot of studies that are going on in this, and then again, there are more studies that will be done in this with a PET imaging with nuclear medicine. And we have other ways to look at brain function and how damage to the brain as we age, or in patients have Alzheimer's disease or cognitive impairment. So again, these studies, the nuclear medicine studies and PET imaging, are very, very important to understand more of what's happening in the brain and what we can do. But as you see, in this study, the solution is very simple: to use hearing aids so you can continue to connect with your environment. That's important for the brain health.
Certainly very fascinating, and glad you could share it with us this morning. MedStar Georgetown Nuclear Medicine Chief Dr. Giuseppe Esposito with the details this morning, information on your screen and how you can learn more. Thank you again for your time this morning. Appreciate it.
Thank you so much.